Have you noticed that you've started to lose some range of motion in your shoulder, where it's becoming really difficult to move through full range, or perhaps you're getting some stiffness and pain? Well, this can sometimes be early signs of frozen shoulder, and maybe you've already been diagnosed with frozen shoulder. So we'll talk a little about that in this series and walk through some exercise in the next video. But frozen shoulder is a rather difficult condition to treat. Typically it goes through 3 stages of freezing, frozen, and thawing, where that progression just naturally has to occur. And unfortunately, there's not a lot of really good data about how to improve or speed up the recovery process. And it can last sometimes up to a year or sometimes more than a year, lasting a couple of years before it fully recuperates. And there's even some research to show that early physical therapy or physiotherapy in doing things like mobilizations and exercise may actually slow down that process. So it's a bit of a tricky condition to treat, and a lot of it you kind of have to just go through the process until it starts to recover. But once you start to get your range of motion back is where we can start to incorporate more exercises to get your mobility back and get your strength back around the shoulder. So that's what we're going to cover in this next little series for you if you are dealing with frozen shoulder.